Good afternoon, everyone, and thank you so much for joining us today. The Amputee Coalition is proud to share the results of the 2021 Needs Assessment Survey. Today, we will discuss how those results will influence our advocacy efforts and promote better care and services for individuals with limb loss and limb difference. My name is Shawnee Seals. I'm a consultant with Avalere Health, and we assisted the coalition in conducting this survey. I'll be moderating today's discussion, but before I introduce our panelists, I want to give a huge thank you to the participants who helped in crafting this survey. We had over 1,700 individuals who took the time to respond, and we are so grateful for your contributions. Our panelists today include Jerica Thurman, Communications Director at the Amputee Coalition, Joe Lynch, Senior Research Scientist at Avalere Health, and Zach Hearn, Director of Government Relations at the Amputee Coalition. We will begin now by discussing the results of the 2021 Needs Assessment Survey. You can access those survey results by utilizing the link that has been provided in the chat. I want to first turn my attention to Joe. Joe, can you share with us information about the participants who were included in the survey?
I will, Shani. Thanks for the introduction. What we saw in the survey, those participants, the race and gender makeup was largely reflective of what we would anticipate seeing in the population, where it's roughly 50-50. It was slightly more male than female. Our race breakdown was as we see in the general population, it was largely white with representative responses from those that are Black, Asian, and so on. Where we started to see some deviations, some differences that we didn't anticipate is actually amputation cause. For those respondents that participated in the survey, 44% responded that their amputation cause was by trauma, whereas in our clinical work, we find that the majority of folks that have amputation or limb loss or limb difference are due to an infection or a surgical complication. So we do see some slight variations there in type, and we do anticipate that has some impact on these survey results, but very little. We don't think that we're because of any overrepresentation or underrepresentation, that we have any bias as a result of these analysis.
Thank you, Joe. Jerica, can you tell us how these demographics apply to the community at large?
Sure. So this survey helped to confirm that African Americans are 4 times as likely, and the Hispanic or Latinx community is 1.5 times as likely to experience amputation than white Americans. Most common amputation causes are diabetes and vascular disease, as noted by the 8.6% and the 4.9% of the survey respondents, respectively.
Thank you. In the survey, we were able to highlight physical and mental health priorities. Joe, can you describe to me those physical and mental health priorities that were identified by our participants?
Sure. Our top line priorities in the physical health realm was simply the ability to exercise. That was ranked very highly. 25% of respondents indicated that was among their priorities. And among those for mental health, techniques for better sleep rose to the top, with 55% of our respondents asking for it, asking for information about that to understand a little bit better. We then move into areas like strength and balance. Strength and balance, very clearly a matter with limb loss and limb difference, as asymmetrical problems tend to result in loss of issues with strength and balance. And then we started looking a little more closely at assisted device availability. 13.8% of the folks that responded to the survey indicated that is a priority. And then finally, we're looking at access to prosthetic devices in general. And that still hovers at around 13% of respondents as being among their highest priorities.
Thank you. Jerica, is there anything that you would add to that regarding assistive device priorities?
Yes, as Joe just mentioned, about 13 to 14% of the survey respondents said access to prosthesis and device performance or comfort were priorities, and the potential reasons for the access change challenges may include insurance coverage, policies on the state and federal level, as well as socioeconomic status.
Thank you. Since we're talking about access challenges, Joe, could you provide us with additional details in that area?
Sure. Social supports came up as one of the highest areas where we had an interest in understanding things such as the Americans with Disabilities Act was pretty high. In addition to looking for assistance with insurance and just basically working on improved quality of care. And as we looked a little bit more closely, they also were very, very interested in community supports. But about 16% were looking for community connections for folks with limb loss or limb difference. Practical home adaptations was also up there at around 16% as a very important priority for these particular groups. And amputation prevention strategies and strategies looking for at either minimizing existing injuries, reducing likelihood of future complications, or even reducing future amputations on unaffected limbs rose very high. It was earlier identification through assessments was a high priority there. Strategies for injury prevention came up as a pretty high priority among these groups. And then ultimately medical interventions to reduce future amputations was listed as a very high instance of how they want these community and social supports to help them.
Thank you. Were there any demographic groups who reported experiencing more challenges than others?
We did see that. We did see that there were community groups, the Black and Latinx community, as Jerica indicated, also indicated greater issues with access, issues with availability, and some issues with understanding coverage and basic insurance problems were highlighted as issues among this group. Jerica, were there other groups that you would see as identified?
I think you covered it most of them, and I think that also leads to what Amputee Coalition is doing to particularly target those living with diabetes or vascular disease, as that's a large population, that represents a large population of people of color and low income. And so I'm happy to share that most recently the Amputee Coalition designed and is currently implementing communication strategies specifically targeted to that group. Additionally, our government relation team provides advocacy programs to address inequitable care that people of color experience and promote policies to solve this problem. And Zach will share more of that momentarily. We also are working to broaden our partnerships with other national organizations and community and faith-based organizations to increase the awareness, the reach, and engagement of our special resources, particularly provided through our National Limb Loss Resource Center. And those are ways that helps to close the gap really on, what resources are out there targeting these specific demographics.
Thank you, Jerica. Joe, you mentioned some of the knowledge gaps as it relates to the laws and services. Are there any other knowledge gaps that were reported during the survey that you would like to highlight?
I would, and yes, there were other gaps. And as we talked about in the areas, the physical and mental health priorities that were identified early, techniques for improved sleep, techniques for exercise, abilities to improve their strength and balance were areas that were identified as very important for those with limb loss or limb difference. understanding the insurance benefits and access to the Americans with Disabilities Act, particularly the requirements around the ADA for accommodation and employment and insurance and access, were all areas that were felt that advocacy groups could further assist folks with limb loss and limb difference to understand.
Thank you. Jerica, can you tell us about how that ties into the coalition's peer support programs and how that can serve as a benefit?
Yeah, so we continually see a need to promote our peer support groups, as many people living with limb loss or limb difference are unaware of these peer support opportunities available to them. So Amputee Coalition develops free, reliable resources to help answer questions about living with limb loss and limb difference, available through an online resource center, particularly our, again, National Limb Loss Resource Center, which is operated or provided through a cooperative agreement with the Administration for Community Living at the U.S. Department of Health and Human Services. We also recognize peer support as critical to recovery for those experiencing limb loss. With over 400 support groups and over 1,500 peer visitors across the country, the Amputee Coalition's peer support offers emotional support, encouragement, and information vital for full recovery. We also work to raise awareness about limb loss and limb difference and advocate for equal access to medical treatment, insurance coverage, and care. And we work to grow support for the PwLL Study Act, which again identifies best care practices for people living with limb loss and limb difference. And then lastly, we host educational events and programs year-round to help people with limb loss and limb difference live full and productive lives by teaching life skills, providing health and recreational tips, and creating opportunities to network with others.
That's awesome, Jerica. Thanks so much. That actually provides us with a good segue into Joe providing us with the statistical background from the survey on the top 3 needs or categories identified by the participants as it relates to what resources they need. Can you tell us about that? And this would be under the community and social support needs.
Again, the community and social support needs, we spoke a little more closely with their community connections. So as Jerica laid out, ways for folks with limb loss, limb difference to meet other folks, to move along in a manner to accomplish some of these other goals of improved activity, improved exercise, improved sleep. Some other community needs to work those through. In addition, the group spoke also a lot about practical home adaptations, some either access to those adaptations or which adaptations might be best suited for their specific limb loss or limb difference. And then ultimately self-advocacy training. How can I take care? How can I be my own best advocate? Where can I reach out to particular resources? How can I get those resources in my life? So these 3 are the areas that came out to be the highest priorities among participants in the survey.
Great, thank you. I think that's a good segue into advocacy initiatives and policy initiatives for 2022. We will welcome Zach into this conversation, but before we get started, Jerica, can you share with us the coalition's plans for 2022 and beyond?
Wow, so we have quite a bit of things outlined for the next few months, namely in ways that highlight our 4 pillars: support, education, prevention, and advocacy. And so I'd just like to take some time to unpack that. For those of you who may not know, Amputee Coalition is the only national nonprofit that serves all individuals who experience limb loss or limb difference. We are dedicated to ensuring that no one faces limb loss alone. Our mission is to reach out and empower people affected by limb loss to achieve their full potential, again, through support, education, advocacy, and prevention. we work to provide vital resources to people with limb loss and limb difference, as well as their families and caregivers. With these resources, they can recover, readjust, and live the life they most want to live. When we talk about support is very personal. Everyone needs to connect in a direct and impactful way with others to move through their own stages of recovery. We offer peer support through individual and group interactions, as well as institutional support through partnerships with the hospitals across the country. Our national support group network provides a place for people with limb loss and limb difference and their families to, again, connect with others who have overcome similar challenges in a safe and supportive environment. We have over 400 registered support groups across the country, including weekly virtual support groups. And then our certified peer visitor program allows over 1,000 certified peer visitors to meet with amputees and family members in their times of need, virtually or in person. And to support young people living with limb loss and limb difference, we're currently planning, under the leadership of Zach Hearn, the Patty Roseback Youth Camp, which is provided each summer to provide an opportunity for kids ages 10 through 17 living with limb loss or limb difference to connect with one another in a traditional camp environment full of fun, interactive activities to promote independence and team building. Our camp is completely free to our youth participants. In our hospital rehab facility partner program, we team up with hospitals and rehabilitation facilities across the country to disseminate our expertise, our training and curriculum and patient education materials. Currently, we have over 90 registered hospital partners across the country, and we are rapidly growing this program because it is one of the best ways to reach new amputees. When we speak about education, we're focused on informing and empowering individuals so they have the resources necessary to thrive on their limb loss and limb difference journey, whether it's the gate clinics at our national conference or identifying gaps in understanding through research such as this. The Amputee Coalition is committed to the dissemination of cutting-edge knowledge. We're currently planning our 2022 National Limb Loss Resource Center. We're currently planning our national conference in Palm Desert, California, August 10th to the 13th, and we invite all of you to attend. And we will actually have a dedicated workshop at the conference about the community needs survey results. So we'll put a plug in and invite you all to come to that workshop if you're in California. The national conference is our largest event of the year, and it includes educational courses, workshops, and information sessions to provide opportunities for members of limb loss and limb difference community at all phases in their journey to connect with one another and find support. It is the largest single gathering of individuals living with limb loss and limb difference. And then throughout the year, in April, we completed our limb loss and limb difference awareness month. We have upcoming some limb loss education days, more trainings for certified peer visitors and lead advocates. And so we invite you to stay engaged with us. I'm going to let Zach explain more about advocacy, but I would like just to end that through research such as this, we are committed to preventing ignorance and indifference to the needs and concerns of those within our community, the limb loss and limb difference community. Thank you.
Thank you. Zach, we want to turn to you now. Tell us more about policy advocacy and how those 4 pillars fit into 2022 agenda.
Well, thank you. And first, I'd like to say how important I feel that this survey is for the advocacy team at the Amputee Coalition. And it is a way that we will be able to directly respond to the needs of the community. When we go and advocate for certain positions, certain policies, it's nice to be able to have something to say, hey, look, our folks say this is important to them, and we can respond to those needs in a much more concrete way than perhaps we could in the past. But this information will help us educate lawmakers and advocate for improved state and federal support. We can work to ensure that resources are available and accessible. And finally, we also seek to improve or to finally reach health equity. And that is something that has been sorely missed within the medical community forever, I suppose, but has certainly become much more glaring in recent years. The roots of our decisions our decisions will be rooted in this evidence of support from our community, and that we have that backing through this survey. Areas where I can see this being used is we're currently going through the AAA Study Act process now. We are moving towards having that study started in July or early August. We're able to advocate for removing barriers to comprehensive care in underserved communities, understanding integrated care gaps across programs, addressing the opioid crisis, finding new ways to address pain, and advocating for improvements to mental health care nationwide. But also for an organization that's maturing and strengthening its grassroots advocacy program, just putting a plug out there for anybody that wants to become a lead advocate, that this allows us to identify ways to employ you all in different ways and to really strengthen the advocacy core and that network of folks that we have throughout the country to remain in contact with your legislators to help us push things across the goal line that need to get pushed. And finally, this survey allows the government relations team to serve the needs of the community, and it also allows the community to recognize common ground and issues that we all can work on together to achieve. Thank you.
Thank you, Zach. Before we open up our question and answers to our audience, do any of our panelists have any finer points that they want to add, or any survey findings that they want to highlight for our attendees today? Great. Now I want to open up the discussion to our audience. If you have any questions, please feel free to come off mute, or I will check the chat to make sure that I've captured everyone's questions, and our panelists are happy to respond to any of your concerns or comments.
Shani, if I could, before the questions start, and hopefully inspire a question or two, is I want to point out that in the process of analyzing these data, I don't think I was surprised by any of the responses beyond that of the fact that all of the responses made it pretty clear that the needs of the community are well known. I think the coalition is moving in a good direction in addressing those needs, and by performing this survey and making an attempt to understand them as an overarching framework under which to address them is going to move things along a lot faster and a lot more efficiently. So I do want to applaud the coalition for taking the steps of actually asking their community what they need versus making the assumption that most do, but more critically about developing a plan around the results of the survey, actually listening to the results and developing the plan as a result versus anticipating the results and building a plan that they wanted to do to begin with. So I hope that folks that are listening to this webinar do take the time to take a look at the material that the coalition has developed and understand that the coalition has been listening and moving these things forward.
Thank you, Joe.
Thank you, Joe. And I'd just like to add that this, as was stated, is part of our overall thought leadership initiatives. You know, there's an opportunity to establish our voice, our collective voice on the national scene. And so we're really excited to work with PwLL in producing this report. And we're hoping that you, our community, continue to stay engaged, because it is your stories, your experience that adds credibility to the work that the staff at the national office is doing on your behalf. So I want to thank you all for participating in this survey. Please continue to stay engaged. We're hoping to roll out new research, new white papers in the coming months, and we will need your voice a part of that process every step of the way. Thank you.
Thank you, Jerica. Sharon, thank you so much for joining. We would love to hear from you.
Yeah, I just had a question on how many people was the survey sent to? And out of that number is 1,700. Is that a, do you feel like that's speaks for, the 2 million people that we have with amputation across the United States? If you could comment on that.
This is Joe. Sorry, I'm scrambling for my mute button. What I understand is the survey went out to 1,700 people, or more than 1,700 people. We had 1,700 respondents. I don't know the exact figure that went out there, but it was, if we've got 1,700 respondents, I'm pretty sure it went out to more than 5,000 people. In terms of representativeness, there are some, and forgive me if I get too nerdy about all this. I am a geek after all. This is what I do. This is the analysis is what I do. But how representative these surveys were, we didn't do the statistical tests required to show that it is representative of the responses, but the rates at which we got the responses, we feel comfortable that the items identified in the survey and the findings in those surveys were identified by a large enough and a different enough population that we can say that these are by and large representative of the needs. I can't say the degree to which they are, but I can say that they are generally representative. Does that answer your question, Sharon?
Yeah, it does. I was, just kind of the most thing I was curious about was, how many it was sent out to, if it was like 5,000 people, 10,000 people, and stuff. And, when you were talking, this is another one, when you were talking about the 44% of trauma, I'm wondering sometimes too, if, everybody may consider their amputation traumatic. And, and if you think that that was a high number, it's like, well, even if you were vascular or diabetic, and you had gangrene set in, I mean, would people even consider that traumatic? So I'm just kind of curious. It's like sometimes if it needs to be made simpler type terms or defining what you mean by trauma, because for me, trauma means an accident, a vehicle accident and your limb is left there. But, some people may consider any amputation traumatic.
You're absolutely right. And I don't think any of us should even pretend that any amputation isn't traumatic. But your comment on words is important because words mean stuff. And yeah, you're right that when we use the term trauma, we're talking about the amputation cause. It was either a trauma, a car accident, or a plane crash or something to that effect. Okay, but maybe we can find a better term so that we're not looking at it, because you're absolutely right. Any amputation, no matter how large or small, is traumatic.
Well, and just, I know by, I previously worked in a hospital with a lot of patients, and, we had to really get it down to the 5th grade level of reading of the handouts and stuff like that. And, and I just recall, having to really define a lot of things. When we're kind of in the field, we kind of use terminology that, maybe, somebody who's, not, I'm not sure, intellectually developed mind, that would, they had, even if they had a toe that was amputated, that may be considered traumatic to them. And, and it's like somebody who lost both legs in an accident, that's what they consider traumatic, which how I would define it. So that's why I'm just kind of, wondering too. And I took the survey, but I don't remember how the questions were asked, and I'd almost have to see it again. But yeah, I wonder sometimes if you don't need to really define those, the trauma and, some of those the terminology a little bit.
Thank you, Sharon. That's a good point to make. And I'm sure if Avalir has the opportunity to participate again, we'll make sure that we are clearly defining words so that as participants are filling out those portions of the survey, they're clear on what information we're looking for. So thank you. Are there any other points or questions that you have for our panelists?
I just want to emphasize the infographic that Avalir did such a great job in producing for us. So please do take time to look through that, that data set. That is also shareable. So feel free to share that with your networks, as well as the full report that's available at the link that's been provided in the chat. So please take time to actually read through that. And there's sharing some more explanation on the method, research, and so forth in the actual report. And so we are excited now to first make you a priority now that you all took time to participate in this survey. You were our first priority, making sure that we reported to you on the outcome of the survey. And then now we'll be moving forward with sharing the information with our larger community, as well as with the public and with reporters. So you will be seeing more to come around this survey. And as Zach has mentioned, there's some key, I want to say key takeaways that we will certainly continue to discuss with on a policy level. So we're very excited about what we will be able to accomplish through the research outlined in this report. And I really do encourage all of you to share it. That's how we get the word out. Share it with your network. Thank you.
Thank you so much, Jerica. Do any of our other attendees have any questions or comments? We encourage you to come off mute and engage our panelists. We're happy to answer any questions you have. Do we have any other attendees who have any questions or comments for us? And I don't want to close out too soon, so I'll turn to our panelists again, just to give John some time, just in case he decides to chime in. Do we have any final remarks from our panelists before we close out? Oh, I see. So Rex is saying he doesn't have the option to unmute. So let's see if I can fix that for everyone. Okay, does that fix the communication issue? I think we had a few people who couldn't come off mute. Okay, I'm glad that is fixed, Rex. Now, John, please, I see your hands up. We would love to hear from you. And it looks like no respondents right now. So Jerica, I'll turn it over to you. Should we give everyone a few moments, or should we just open up the option for everyone to send us an email? We would be happy to respond after today's session.
Absolutely. In closing, I would just mention that currently in our database, we have over 30,000 contacts for people living with limb loss and indifference. And while that sounds great, we realize there's still an opportunity to diversify those contacts. So we are working to increase our reach, increase our engagement and our awareness so that we can grow that database so it has a better representation. So when we continue to do research such as this, we would be including other demographics by the the contact growth. So again, it comes down to everyone has a part to play. Spread the word, invite people to engage with the Amputee Coalition, and let them know of the good work that we're doing around research and working to elevate their voice. And so I just want to definitely make that call to action. Thank you for being with us here today. We thank Avalier, who stuck with us through a very long and tedious process to get us to this point that we can now report out. And again, this is something that we're hoping to do regularly. So stay tuned. If you would like to get more information about this report, feel free to email us at communications@amputee-coalition.org. communications@amputee-coalition.org. And we'd be happy to provide you or answer your questions, provide you more details. Again, feel free to visit the web link where you can access the full report and infographics. And stay tuned, we'll be also posting some social media language for you to share on your social channels. So we really appreciate you just taking time to spend with us today to learn about this report. And we're just really excited to start spreading the word about it. Thank you.
Jerica, really quickly before we close out, it looks like Rex entered in a question, and I think it's an appropriate question for either you or Joe or both of you to answer. Were there any specific areas identified where we can better help our community?
That's a great question, Rex. There are a lot of interlocking or interrelated areas that really rose up as high in the responses. The physical needs of basically just improving your ability to exercise, techniques for better sleep, peer support group, rehab services. There were a lot of social and community aspects that were listed as important among the respondents in the surveys. And it strikes me that a member of this community with limb loss and limb difference, every single member of this community has an opportunity to sort of lead in this particular space. Either going back to what Jerica mentioned with language in some of your social media spaces to let folks know that you're part of the community, or allow folks to understand access to or that there are techniques that are available. So being a vocal member of this community, attending sessions just like this to understand a little bit more the needs of the group, and bringing those back so that when you're participating as an informed individual, which is eventually going to help that community a little bit more. Jerica, do you have any other suggestions?
I think you covered it very well. The only thing that I would like to just continually emphasize, as I do through our other communication resources like In Motion and other things that we put out, is mental health, which is a critical area for all Americans, but particularly for those living with limb loss or limb difference. And so I like how there's actual data now that we can abstract from this research to advocate for stronger mental health programs to support for our community. And so I certainly think, Rex, that's, the more voices and advocacy around that, making that a priority for this group, now that I think mental health has become, I'm going to say, top line for a lot of our policymakers, would really help to advance some of the support that we need for our community. Thank you.
Thank you all for joining today's meeting. Resources were dropped in the chat for your access and availability, including the survey, the actual survey results. So we encourage you to go and look at that and to reach out to the Amputee Coalition with questions and comments. Thank you, everyone. Oh, I'm sorry. Is it Vala? Vala?
No, I have no question.
Oh, you don't have a question?
No, I'm fine. Sorry.
Okay, no problem. Well, we're so glad that you can join us today.
Thank you.
Thank you, everyone, for attending, and it's been a pleasure. I hope everyone has an awesome week.